You have a discharge and you're wondering what it might be. In this video, I will explain you what STD is necessary and can be done for discharge you might have. STD testing can be done anytime you have abnormal discharge, whether it is vaginal, penile, or rectal. But here are a few things to keep in mind regarding test results. When you are symptomatic and the test results returns positive, it's excellent way to establish the cause of your symptoms. But if you're symptomatic and the test results are negative, it means only that STDs that you are being tested for is not the issue of your current symptom. Does it mean you are STD free? The answer is no. It means that a tested STD is not the cause of your current symptoms. Other tests need to be done to come up with a proper diagnosis. It is crucial to understand that to rule out an STD, the timing of the test is a single most important thing. This means that the testing should be done after incubation period, which differs for each STD. Since the topic of our video is discharge, and chlamydia, gonorrhea, and trichomoniasis are the most common causes of the discharge, testing 3 weeks after exposure should be enough to rule out those conditions. My name is Slava Fuzailov, and I'm a practicing STD physician at STD Center NY, located in Midtown Manhattan in New York City. I know you have limited time, and I value your time. Let's proceed. Since we're discussing the discharge, let's define abnormal discharge first. Certain body parts, such as the vagina, penis, and rectum, always have some discharge, which is regular lubrication produced by the body. So what is abnormal discharge? A combination of two things make discharge abnormal. Fluid dripping spontaneously on its own without squeezing, fluid that is different from standard baseline fluid. For example, new discharge, more discharge than normal, a different consistency, thicker or thinner, a different color, yellow, greenish, blood tinged, an unusual smell, fishy usually. Let's talk about few different discharges, penile, vaginal, and rectal, that might be an STD. Let's start with the penile discharge first. The penile urethra produces some lubrication. Usually you can see it by squeezing or by milking the penis. The abnormal penile discharge is a fluid coming out of the penis on its own without squeezing. The amount of discharge can be different. Copious, or a lot, that it's soaked through the underwear. Or minimal, the amount of discharge is so tiny that we need to rely on indirect signs, such as staining of the underwear, especially noticeable with white or black underwear. The urine stream can split into few directions in the morning. It happens mainly in the morning when a dry crust forms at the urethra opening overnight. So if we see a penile discharge or suspected, testing can be performed and treatment can be offered simultaneously. The most common STD that cause penile discharge, not discharge in general, but penile discharge, are chlamydia and gonorrhea. So those two conditions need to be ruled out as a first step. If chlamydia and gonorrhea tests are negative, other tests will be necessary, such as mycoplasma, ureaplasma, trichomoniasis. None of these three conditions are expected in males, and tests for them are not commonly performed as a first step. The test for penile discharge for all conditions can be done via urine or urethral swab. The accuracy of both test types is about the same. So urine test is a preferred method. If there is a penile discharge, it's customary to treat the person with a ceftriaxone shot that treats gonorrhea, or doxycycline pills for 7 days treats chlamydia, while waiting for the results to come back. Now let's talk about abnormal vaginal discharge. Before proceeding to the vaginal discharge portion, I would like to take a moment and ask you for a favor to support our channel by liking this video or subscribing to our channel. Let's go back to our topic of STD testing for abnormal vaginal discharge. The vagina typically has a discharge that is different from person to person. Every woman knows what your baseline discharge look like. So what is abnormal discharge then? Abnormal vaginal discharge is any discharge different from a baseline, such as a new type of discharge, more discharge, a different consistency, thicker or thinner, a different color, yellow, greenish, blood tinged, unusual smell, fishy. When abnormal vaginal discharge is reported or noticed, the following STDs need to be checked: chlamydia, gonorrhea, trichomoniasis, mycoplasma, bacterial vaginosis, and yeast infection. If all those tests are negative, a test for ureaplasma can be done. Let me briefly touch on the topic of ureaplasma here. Ureaplasma can be part of the normal vaginal flora in females with more than one lifetime sexual partner, and for that reason, this test is not routinely done. But it is done when other infection causes of vaginal discharge are excluded, since occasionally ureaplasma overgrow, causing excessive discharge. If the above tests are all negative, a gynecologist should be consulted for non-infectious vaginal discharge causes. The ideal test for vaginal discharge is a swab. Urine test should be avoided since it can give false negative result. As with penile discharge, vaginal discharge can be treated while waiting for the test results to come back. The vaginal discharge treatment is slightly different since non-STD causes of discharge such as BV and yeast infection are common in females. The initial treatment is offered based on symptoms and visual examination of vaginal area and the discharge. The person can be pre-treated for chlamydia, gonorrhea, BV, or yeast infection. Now let's talk about the rectal discharge. So what is rectal discharge? It is fluid coming out of the rectum at rest, or a significant amount of mucus noticed with defecation. Spontaneous rectal discharge, when fluid comes out of the rectum without defecation, or what we call at rest, is uncommon. What is more common is noticing a lot of mucus with defecation. It can be covering the stool, or it can be a false or frequent urge to defecate with nothing but mucus coming out. For people that practice anal receiving sex, both receiving penis to rectum or mouth to anus, STD need to be performed to rule out chlamydia and gonorrhea. Very occasionally, the rectal discharge is caused by another STD, herpes. When the rectal discharge is due to the herpes, it's usually minimal and for very short time. The main symptoms of herpes infection is significant rectal pain. The testing for rectal discharge is done via rectal swab. If herpes infection is suspected, it can be confirmed visually seeing or swabbing those sores. The preemptive treatment for chlamydia and gonorrhea is an option while waiting for the test to come back. Once the test STDs are ruled out, a gastroenterologist should be consulted for other causes of rectal discharge, such as inflammatory bowel disease. This brings us to the end of the video. If you learned something and it was helpful, please remember to give this video the thumbs up and subscribe to the channel. And if you want to share your experience in the comment section to help others, please do so. Thanks for watching, and until next time.